Blackstone presents Brain Energy, a revolutionary breakthrough in understanding mental health and improving treatment for anxiety, depression, OCD, PTSD, and more, by Christopher M. Palmer, MD. This book is read by Christopher M. Palmer, MD. To my mother. My futile attempts to save you from the ravages of mental illness lit a fire in me that burns to this day. I'm sorry I didn't figure this out in time to help you. May you rest in peace. Introduction. For more than 25 years as a psychiatrist and neuroscience researcher, I have been asked the question, what causes mental illness? Countless times by patients and their family members. When I first began my career, I would give long answers that made me sound educated and competent. I'd talk about neurotransmitters, hormones, genetics, and stress. I would describe the treatments we would be using and offer hope that they would make things better. After a few years of this, however, I began to feel like a fraud. You see, people often weren't getting that much better. Treatments would sometimes work for a few months, or even a year or two, but more often than not, the symptoms would come back. At some point, I began telling people the simple truth. No one knows what causes mental illness. Although we understand many risk factors, no one knows how they all fit together. I still tried to offer hope by assuring people that we had many different treatments at our disposal and that we would try one after another until we found one that worked. Sadly, for many of my patients, we never did. That all changed for me in 2016 when I helped a patient lose weight. Tom was a 33-year-old man with schizoaffective disorder, a cross between schizophrenia and bipolar disorder. He had suffered from hallucinations, delusions, and mental anguish every day of his life over the last 13 years. He was tormented by his illness. He had tried 17 different medications, but none had worked. The medications sedated him, which reduced his anxiety and agitation, but they didn't stop his hallucinations or delusions. What's more, they'd caused him to gain over 100 pounds. He had long been plagued by low self-esteem, and being so overweight only added to this. He had become a near hermit, and our weekly sessions were some of his only excursions into the outside world. This is partly why I agreed to help him lose weight. I was the doctor he saw most often, and he wasn't in the market for a referral to a specialist he had never met.
Sample complete. Ready to continue?